So, hi, Claire McGing. We're delighted to have a chat to you today about dry eye. Um, Claire, we've known you for a while, but you are someone that suffers with dry eye, and we would like to discuss your journey of diagnosis and how it has impacted you. I know that you have a very active social life, but also a professional life as well. You work in politics, media, TV, and radio in Ireland. I suppose it's something that dry eye affects everything. So, I suppose just give us a little bit of introduction to yourself, Claire, and again, when you were diagnosed with dry eye disease.
Yeah, thanks, Adele, and glad to be here, and thanks for the invitation. I suppose I would describe, you might say your journey with dry eye. In my case, I would say my odyssey with dry eye would be a more appropriate term. There's kind of a short and a long history in my case. I've always had a little bit of dry eye, you might say. I'm very short-sighted, and I started wearing contact lenses at about 14, 15. And at that time, I was aware the contact lenses, and this was a number of years ago now, wasn't when we had the advances in contact lenses that we do have today. And I noticed that they would dry out quite quickly. I'd be using drops. I remember being in school and I'd have to be putting in maybe 2, 3 drops a day, but it was manageable. And once the contact lenses came out, I got a couple of hours out of them. Once they'd come out, there wouldn't be anything wrong. And all throughout my teens and my 20s, I was a regular contact lens wearer, could wear them for 7, 8, 9, 10 hours a day, sometimes 12, 13, without any real issues, bar having to use some drops. My eyes would feel a little dry after, and that would go away. It became chronic for me, or quite severe, just about 4 years ago now, back in 2018, where my first symptom, and I believe this is quite common in lots of people, was that I became kind of intolerant to contact lenses. So no amount of drops would work or would help any longer. After 2, 3 hours, I just couldn't bear them in the eye any longer. I thought originally I might have an allergy, and I started taking antihistamines, which I now know make dry eye worse, potentially. Um, I kind of struggled along for a couple of months, switched back to wearing glasses. And when I wasn't wearing my contacts, I was fine. But then kind of it seemed to happen overnight where I developed eye pain, a burning sensation. It started for me in my left eye. My left eye is much worse than my right eye, and still is to this day for some reason. And I went to my GP about it. Was given at that time a steroid, that seemed to calm it down, and then it came back with a vengeance essentially a couple of weeks later. So long story short, I was referred to a specialist, in Dublin, to a consultant ophthalmologist who did all of the, like, loads of different tests. I think it was like an hour and a half, nearly a 2 hour appointment. Everything was checked, and I was diagnosed with dry eye disease. As I say, I'd always had it, but it had become particularly bad kind of in my late 20s, early 30s. I have a two-pronged problem. And anyone listening to this who's kind of well along in their dry eye journey will probably know more than me, or as much as I do, or more. But I have what's called meibomian gland dysfunction, where my meibomian glands are clogged up essentially, or don't produce enough oil. When I was first diagnosed, I had no oil at all in my eye. That has slowly improved over time. And I also have what's called an aqueous deficiency, where my puncta are quite large, and the kind of the water is draining from the eye, is my understanding in layman's terms, of it. So that was my journey and how I came to diagnosis, of dry eye disease.
Okay. And Claire, you mentioned a few kind of symptoms there regarding pain, discomfort, burning, dryness. I mean, how do these affect your quality of life?
Oh, hugely, hugely. And I mean, in every way. I mean, for me, there was and I'm aware that this sounds vain, but it's important to me. For me, there was the huge psychological issue. I could no longer wear any eye makeup, could no longer wear contact lenses. For a woman who loved her eye makeup and loved her contact lenses, that for me was huge. And it took me a long, long time to come to terms with that. I'm probably still not totally at peace with it, to be honest. But it is, I now would kind of just take not having the pain and
Mhm.
not having eye makeup. That's kind of the journey I've gone on. But beyond the eye makeup and the aesthetics, I mean, it had a huge impact on my professional life, my personal life, any event I was at, any meeting I was at in work, and my eyes were burning. I mean, literally burning all the time, felt like they were on fire. And that for me was the number one symptom. I never really experienced any kind of eye redness that some people seem to have, which I feel so sorry for people. You wouldn't know by looking at me that I had really sore, burning eyes. And I think that was the hardest part. So a major impact. I remember being in a wedding about a year after I was diagnosed. I was in a particularly bad place at that time. And I remember going back to the hotel room and just crying, ironically crying over the dry eye, but it had a massive impact on my life in every way. Having a diagnosis, I think, helped. At least I could
Mhm.
understand what was going on. Um, but it definitely took me a long time to kind of find some kind of a treatment or management regime that, certainly I'm never going to be cured, but certainly that did put me into a much better place.
Okay. So, when you mentioned that, you mentioned your physical reaction, you were crying because of the pain and the
Literally, yeah,
discomfort.
literally.
Yeah. And I mean, it's something that we heard before, and we've heard in, previous talks from the Dry Eye Foundation in the US regarding anxiety. Is that something that was is, a feature for you regarding your dry eye?
I mean, yes, and I suffer from anxiety anyway as a person. I've always been kind of an anxious person. I was actually treated for anxiety as a teenager. So you put that on top of dry eye. And absolutely, anxiety was something that I struggled with. I still, to some days when I'm really bad, I have to be honest, get anxious. Oh my God, is this what my life is going to be like? But in the early stages, that was something I definitely had to work through. And then for me, I have learned that I kind of everyone I understand, I know that dry eye is a very complex disease. It can be caused by lots of different things. In my case, there's no kind of real obvious cause, to be honest, but I do know that stress for me makes it so much worse. So I was just saying to you before we started recording, for me in the early stages, and I still experience this, if I have a big event coming up in my life, whether it's a big work event or I do a lot of television work, so if it's going to be a kind of a big day in professionally, or if it's a personal day, like my best friend getting married, for example, next year, one of the big things for me, a huge chunk of my physical and emotional times is always spent by thinking, will my eyes be bad that day? And I know that that's a vicious cycle. My optician tells me if you think about that, you'll get worse. But I think that anxiety is a huge part of the dry eye journey. And for me, as I say, it's double pronged. It's worrying about will my eyes be bad? And in some cases, I've had days where my eyes haven't been bad. So I'll give it, this might help people, but I did have a wedding last year, and honest to God, Adele, I spent 2 months worrying about my eyes
Mhm.
at a wedding,
Mm.
and they were fine all day. I actually could wear my contact lenses for the wedding. So I had no reason to be fearful that day, but there could be a day I do get up and I do have a big event where they are bad. And I've just had to just kind of make peace with that. But that anxiety I think, is a huge factor for a lot of us suffering with dry eye disease. Yeah. And I think we need to talk about it actually more openly.
So, Claire, you mentioned there, you worked through it. Do you mind me asking, what do you mean by working through it? Do you have little things that you do or to help you, or is it just being mindful about it?
It's being mindful about it, I think. I mean, there's a number of things, I suppose. So I said I was diagnosed with dry eye disease, and with
Mhm.
that came a treatment path or a management path for me. Some things didn't work, and other things did. And you did mention like the dry eye forum in the US. I mean, I've probably had pretty much everything you could try done in the Irish system. What did work for me was, or what really put me on quite a better course, was I had a treatment, IPL treatment, and my glands were expressed after, and I still go for maintenance doses. I'm actually due a dose actually in a couple of weeks. And that for me was really the game changer, to be honest. I know that doesn't work for everybody, and your glands have to, my understanding is that if your glands are kind of atrophied, that's not going to be much good, but my glands weren't, and I was lucky that that did help To some extent. It meant that I still get the symptoms, but they're less severe now than they used to be. Definitely. I also had another procedure done where I had plugs put into my eyes, and they kept falling out. My puncta was so big. My joke with my doctor was that every girl wants to be told she has very big puncta, but in my case, it's true. They are quite large, and they kept falling out. So I was actually had mine cauterized, permanently cauterized on two sides.
Mm,
So those two things for me definitely helped, from a treatment point of view. And then I think I've tried pretty much every eye drop that's available in Ireland or the UK or the United States. And I did manage to find two for me that have for me been in one case I would say it was life changing, actually, one particular drop. I don't know if I can name it. Can I name it, Adele?
yeah, go ahead.
Yeah,
Yeah.
Evo Tears for me was
Okay.
the drop for me that was just phenomenal, and has definitely helped given the nature of my thing. So then there are the treatment options. Obviously, I have to do my work compresses twice a day, or I do in my case, and I've been quite strict with myself on that. There might be days I don't get the second one in, but I'll always get it done at least once a day. If I'm traveling, I'll bring disposable the disposable ones you can get with me. If I'm on a long flight, I'll put one of those on.
Mm,
And then there's a number of other things. It's just become a really big part of my regime. I try to drink loads of water. I try to cut back on. I find coffee seems to some whatever reason seems to kind of can be a trigger for me too. So try to cut back on coffee, things like that. So there's all of those kind of things. And then for me, then there is the psychological kind of stuff, I might say. For me, it's trying to manage stress.
mhm.
And I've been in a stressful job and with a lot of screen time, and that's not always easy. But the way I've done it is that if I have a quieter day in work or a quieter day, kind of couple of weeks in work, I allow those to be quieter days. I do what at my job, but I don't take on a load of additional stuff. So that means that when I'm in a very busy period in work and I've just come out of a very, very busy period
Mm,
of work, it means that I know I have that time to kind of recuperate, if that makes sense. But that's
yeah.
very personal to me. Some people I know other people will be different.
Okay. I think it probably reflecting, Claire, what a lot of people put more effort into nowadays is that well-being
Yeah,
element.
yeah,
And I think what you said there is probably it's just as important as the treatment options that you have available
definitely.
as well.
Definitely. And then if I can say one other thing too on the whole anxiety issue, and look, this is very personal to people, but there is a lot of information out there. There's a lot of dry eye message boards and forums and Facebook groups, and some of it's really good and some of it's not. I was on those things myself for a while at the start. And I made a decision quite early on not to be on those message boards. I know, and I have a friend who I met through one of those boards with very bad dry eye, and she finds it very helpful for her. But for me personally, I actually found it made me more anxious because, I'd be on a new treatment and somebody would post, and so that was my personally for me, I'm not on those, but I'm aware of other people that find those really helpful. But I do think I suppose it's about trying to find really good, high quality sources of information. And I suppose for me, that came from being referred to a dry eye specialist, I suppose, where I kind of feel I was getting a lot of my best information. But just on that point about anxiety, at the very start, at least, they definitely made me more anxious than helped, to be
Okay.
honest.
Okay. Yeah, quite an onslaught of information
Yeah,
there as well. So Claire, you mentioned, could you go back to that question regarding how you manage it? So getting a diagnosis and a proper treatment plan. Now you mentioned that, this really kicked off for you in 2018 when it became quite severe. You know, did it take long to get a diagnosis and a treatment plan, or, can you talk a little bit about that process?
I mean, it didn't take long for me to get a diagnosis or treatment plan, but it did take a long time for me to see the effects of it. So
Okay.
I was diagnosed officially, I think it was either August or September of 2018, and I started experiencing kind of those bad effects, say in the February or March of 2018. So I was lucky in the sense I was diagnosed quite quickly. But there were a number of treatment plans or things given to me that I maybe over time I'm now seeing the effects, but I have to say it was really 2.5 years in before I could move to a point to say that I was in a much, much better place than I was. And I knew I was in a much better place than I was. I mean, there's there's a couple of things I know like about myself. Like, so I love, this sounds really trivial, but it's important to me. I mentioned I love my eye makeup, I love my fashion, I love my clothes. And I found when I was really bad, I lost interest in things that I loved. And when I was back in a place where I was really kind of doing the things I loved again, going to
Mhm.
places I loved, I remember one day actually it hit me that I was in a much better place than I was. So it took me about 2.5 years, I would say, of a treatment plan to see any changes. The way I now put it now is, to give anyone, and I know there'll be people watching this who are really, really struggling, and and I've been there too. And the phrase I now use is that I've gone from having kind of good days amongst bad weeks to having bad days amongst good weeks. I still have the bad days. And I had a bad day yesterday myself. I'm much better today, but that is the way I have kind of moved through it. And I suppose, and that gives me hope too. I mean, the way I kind of look at it now is to kind of say, okay, well, look how far I've moved since 2018. How much far will I move in the next year again? So, but it did take time, and it did take me to be very rigorous with everything you have to do. Definitely.
Okay, Claire, it's obviously a very self-aware, and probably I know myself, I chat to myself all the time. You're saying there about recognizing things, just that communication element. Let's say as a maybe you could give some advice there, maybe for a patient going to a professional. I mean, what kind of how do they set themselves up to have the good conversation? And maybe even as well in the same question, for any HCPs listening or eye care professionals listening, is there anything as a patient that makes more sense or a type of language to use? So just think about being in that clinic or in that office scenario with an eye care professional, that communication element.
I think the communication is so important, and I didn't have that communication for prior to my official diagnosis and going to a specialist. As I mentioned, I did suffer with dry eye, but no, but nobody ever kind of took the time to say to me, well, look, if this might help, or there's a particular drop that might help. And so I think that communication is really important. There's a couple of things I would say from a patient point of view. I mean, I've done my fair share now of dry eye reviews. I go back every 6 months and have all of those tests done every 6 months. I had it done yesterday, actually, coincidentally, prior to this. And I go in and I get all of the tear film is checked and all of these different things. I don't really understand what they're doing, but I know that they're checking a lot. And there's a couple of things I would say for anyone kind of starting out in your journey. If you have tried particular drops, or tried particular things, maybe kind of done your own research prior to diagnosis, I would make a note of what those things are, what particular drops you tried. Are your eyes particularly bad in the morning? Are they bad at night? I know some clinics do kind of a questionnaire. I actually honestly can't remember if I did a questionnaire at the time, but certainly any of that kind of information you have, I would say, is quite helpful. Um, I would say too, don't be scared to ask questions. Don't be scared to, and this I suppose goes for healthcare professionals then on the other side, particularly for people who have dry eye and they're so anxious, and we probably know a huge amount and we know very little at all. So one thing for me was I got obsessed with in my initial days was my tear breakup time. I'm now aware of the tear breakup time is so much more complex than I realized as a patient. But even having my doctor explain it to me and and me asking questions and him kind of saying to me, well, look, you look like this and this is an improvement on the last time, whatever. So I would say, don't be scared to ask questions and be afraid. And I would say to healthcare professionals to please, take the time to explain that to people, because there is a huge amount of anxiety going into that. And I know myself, like for me, the real anxiety, given the nature of my condition, and I still get this, is every time I go in, are they going to say to me, Claire, there's no oil in your eye this time? So me being able to ask those questions and getting an honest answer, certainly in my case, really helped. But those questions, and as I say, be kind of prepared, just kind of have a list of things maybe
Mm,
you've tried, I would say.
okay. Be prepared basically,
Yeah,
because
be
once you're in
prepared.
there, it's tougher.
Yeah, no, it
Okay.
is. Yeah, and there's nothing to be scared of for people who are kind of, thinking of going. Don't put it off. Like, it's a little bit like going to the dentist. You just, it's fine. Once you're in there, it's okay. And it's not totally dissimilar to going in and getting your glasses and contact lens. There's
Mhm.
obviously more tests than that, but it's not totally dissimilar to getting a glasses or contact lens checkup. So don't be scared. I would say it's fine.
Okay. And Claire, so obviously, you talk about blogs and that sometimes it can be a bit overwhelming, or, how to filter what's right information or maybe incorrect information. But, once you're in that office, it's a source of good information.
Yeah.
Is there anywhere else that you go to find good information that maybe has helped you in the past, or maybe that's something that you plan to research in the future?
Yeah, I mean, I have to say, I mean, this, I mean, I'm not doing a paid product placement or anything, but I actually do think that Scope's website is really helpful, as a really good kind of source of information and different eye drops and so on is really useful. And then there are a number of sources, certainly, I'm thinking of sources like WebMD in the United States. Like, another one for me was, is it Moore Street Clinic in London, the eye care clinic, the eye hospital there? They have some really
Moorfields.
good, yeah, that's it. Yeah, Moorfields. They have some really good sources of information too. So you can start, I suppose, kind of shift through the good stuff from the maybe the stuff that's maybe not so scientific or so good. And again, all of these things have a place. But that for me has been, just in my journey, has been really important to try and manage my anxiety and not be kind of fall down rabbit holes of treatment options. And in some case too, one thing I found quite anxiety inducing about forums, say based in the US, was that now things are changing here, thankfully, but that treatments may have been available to people in the US that just weren't available to me in Ireland. And unless I paid a huge amount of money to go to the US, I didn't have, it just wasn't. So I try to now stay more local, I think, in,
Okay.
and as I say, the main thing for me is asking both I'm lucky I have an amazing eye doctor and I have an amazing optician who happens to be a dry eye specialist. And really between the two of them, that's where most of my information now, and I trust them as well.
Okay. Okay, perfect. Claire, I could chat to you all day, but we don't have all day. But Claire, just one thing, I can see that you're actually wearing makeup today. And I suppose it's probably more who you are, as you said at the start. You didn't feel like you were
Yeah,
yourself when you couldn't do that.
and I
I
wasn't
mean,
myself. Yeah.
and again, just regarding, researching that, or how did you find something that worked for you? Was it trial and error, or, what did
Uh,
you look out for?
Trial and error. There
Okay.
is a specific makeup brand. Again, I don't know if I can name it. Can I name it?
Well, I think there's a few out there, and depending what country
Yeah,
you're in,
yeah,
yeah.
yeah. Depending what
So there,
country
there
you're
are
in.
out there.
Yeah, so
Yeah.
there is for me, there's a particular brand. It's a French brand that actually is specifically tailored to dry eye and people with blepharitis and allergies and so on. You can find it online. And they do a particular makeup range that I wouldn't use it on bad days. Certainly, I
Okay.
would stay away from anything. But on good days like today, I can put on a little bit of makeup and just feel a little bit more like myself again. Though again, I have to say, and this is part of my journey, and it's probably part of a journey for anyone who deals with chronic pain, not just dry eye. You reach a point where you kind of you would give up anything to do with the cosmetics and the aesthetics if you would just
Mm-hmm.
reach a point where you're normal. So I've made my peace with that. But and I know this sounds really vain, but it was a big thing for me. And I'm at my stage now where if I can get a little bit of mascara and a little bit of eyeshadow on, that's a good thing. But I would rather my eyes just feel normal and not wear anything, to be honest.
Okay.
And that's who I am now,
Yeah,
There's any
yeah,
power
and
in
I mean,
that.
it's interesting you use the word normal there, but that's the goal.
Yeah,
Just for
yeah,
our eyes not
yeah.
to
And
feel abnormal,
yeah,
or
and
yeah,
anything else is a bonus after
yeah.
that for me, But that, as I say, that took me a long play time to get there.
Okay. Claire, I really appreciate you taking the time to tell us how you got there, and your journey, because I think, everyone experiences things a little bit differently, but there's always something there that when you hear other people speak about it, it just resonates, or actually gives you a tip in the other, to progress further in terms of your research or your diagnosis or your treatment. So, um, thank you for your time. I wish
Thanks,
you the
Adele.
best. I hope you have good weeks within months, and more good weeks. And I hopefully will get to catch up again soon. Thank
Thanks,
you.
Adele. Thank you.